Hi everyone and welcome to our Facebook Live event. We are here with Avène's regional trainer for Western Canada, Fabiola, to discuss the beauty of Avène.
Thanks, Maya. I'm so happy to be here on our very first Facebook Live event. So thanks all of you for tuning in.
I am Maya and I'm the beauty advisor from London Drugs. So please post your questions on the live stream today and you'll be automatically be entered to win an Avène skincare prize pack. Comments or questions are welcome, please. So today we're going to talk a little bit about Avène, the brand itself, before we dive into some of the hypersensitive skin reactions and the actual products themselves. So Fabiola, can you tell us about Avène?
Absolutely. So you've said it actually, hypersensitive skin, reactive skin, things we hear about a lot on a daily basis. So it's important to really understand when we talk about brands like Avène, we actually come from a very strong pharmaceutical know-how. Our parent company, Fab, is actually the second largest pharmaceutical company in France with a pharmaceutical division, over-the-counter, and of course, dermatology and dermocosmetics division. Why is this so relevant? Well, of course, when we talk about this, it gives us the really confidence that we have the pharmaceutical know-how, the research, the development, the rigor behind bringing something that is sterile and safe for even the most high-risk skins.
Thank you, Fabiola. So for some of our viewers, what does that mean in terms of transitioning their skincare or some of the symptoms that they may experience going from winter to spring?
Excellent question. So typically, a lot of times when we transition from one season to the next, it's quite common for our skin to go through a number of changes. It could induce flare-ups. You could suffer from things like dry, itchy skin, redness, tingling, burning. This is quite common actually when you have severe climatic changes, or if you've changed from very dry to very humid weather. So this is definitely the season for that. You might get a little bit of that in your store.
And what are some of the common aggressors that, some of our viewers that are at home today could have to set these symptoms off?
Excellent. So aggressors, I like to think of some of the triggers behind this beyond, of course, temperature fluctuations. Typically, if you're under a lot of stress, if your immune system is a little bit low, maybe you haven't been sleeping enough, or overall these types of stress fatigue, sometimes even a side effect of medications, there's a number of different triggers that can, of course, induce flare-ups and induce these type of reactions in the skin.
Now that we know the symptoms and the triggers, what are we dealing with? What is that? How can we identify it?
Well, actually, Maya, there's a few different things, and I think the important one to begin with, and it's something that we really deal a lot with at Avène, and I think here in Canada it's quite relevant, is what we call atopic dermatitis. So typically we're dealing with atopic dermatitis, and to help you understand, I'll explain to you, what is atopy. Well, we know that it is in fact a hereditary predisposition to develop an allergic reaction. So while this can manifest in a number of different ways, be it asthma, rhinitis, conjunctivitis, the one we're going to focus on today is its dermatological form, atopic dermatitis. So it breaks down into two different mechanisms. The first being, of course, an impaired moisture barrier. So as you know, we have a moisture barrier on the skin. It's composed of lipids and, of course, waters. Mm-hmm. And that hydrolipidic film and that moisture barrier, when someone is atopic, they're not producing enough lipids, proteins, ceramides to really fill in, if you will, all the spaces between our skin cells. So an easy way to help our viewers understand, think of a brick wall. And think of each skin cell as a brick, and think of your lipids as the mortar or the intercellular cement in this case. Now you can imagine if you are not, if you don't have enough of that cement in between your bricks, you're going to have some gaps. What happens with that is you'll then have a loss of moisture, a loss of lipids. As a result, you have your first symptom, which we talked about, which was dryness. Now here's where it gets tricky. Because, of course, you have these gaps, not only are you exposed to lose water and such, but now you're exposed for actual external aggressors, external allergens to penetrate your skin.
So someone could see something like that as perhaps redness on the skin or itchy skin. Is that true?
Precisely. So when you have an external aggressor, it could be dust, dander. When it penetrates your skin, what happens is it's going to induce the nerves that stimulate itch. So like you said, you'll begin to have itch. It's also going to induce chemical messengers.
Not comfortable, I'm sure.
No, you. It's not fun having them penetrate. No. So the second symptom you're going to have is, of course, inflammation. And now you see a variety of symptoms like dryness, itch, inflammation. Now, the risky part with atopic dermatitis is that if you suffer from it, you tend to be at risk of infection. And that's basically because in your skin barrier, you have an imbalance in bacteria. So you tend to have a lot more of the harmful bacteria, pathogen bacteria, which can induce infection. So when you look at atopic dermatitis as a whole, you're dealing with an impaired skin barrier, dryness, itch, inflammation, risk of infection. And these are all concerns that, of course, we can deal with. But it's important to first understand what is the concern.
Now, what is the difference between that and eczema? I know some you might have heard eczema a little bit more than atopic dermatitis, so I just wanted to pose the question, perhaps.
I'm glad that you asked, and it's, I'm so used to using the term atopic dermatitis, but this is commonly the same thing that is referred to on a day-to-day basis as eczema. Yes.
Okay, great. So how can we deal with some of these triggers and some of the things that happen, the dryness, the itchiness? What do we need to do, and how can we address them with some of the products we have here today?
Excellent. So, of course, maintenance is key. There's a number of different things that we can do. I want to start off by first talking about Avène Thermal Spring Water. So when we talk about Avène Thermal Spring Water, this is the most medically studied water in the world. It has been published many times in dermatological publications, and in a nutshell, the key benefits from this water is that it's been validated to be anti-inflammatory, anti-irritating, and soothing. So these are the benefits that you're going to have in a water that's safe enough to use on a newborn and up. It's a water that's packaged in the same environment as injectable drugs. So it's completely sterile, and it's the only one you'll find on the market, not only that's sterile and that has the seal of approval of the Dermatology Association. So you can feel absolutely confident, even if it's a newborn child, a small infant, or even if you have open mucous membrane, but it's totally safe.
So for cuts, maybe for kids' cuts or anything like that?
Yes.
I have a personal experience with one day when my throat was sore, and I happened to have the water on hand, and I sprayed it in my throat, and it actually really soothed my throat. So I really love that water for that too.
That's actually a really good trick. That's one of my tricks too. So I'm a speaker for a living, and I have the same problem. I get a little bit irritated after speaking so much. You can actually spray it in your throat. That anti-inflammatory benefit will really soothe any of that. Actually, speaking of seasonal transitions, a lot of us get itchy eyes. Spring is around the corner. We get a lot of pollen, and all the flowers blooming means itchy eyes, itchy throat. So you can actually clean your eyes out with the Avène Thermal Spring Water, and within about a minute, it'll completely soothe the itch. It's safe. Just some other ways to use it is excellent. But getting back a little bit onto treating, of course, atopic dermatitis with the thermal water, as many times as you want throughout the day, you can use it. What I love to recommend is soak a gauze or a Kleenex in Avène thermal water and wrap it in the affected area, and you're going to get a prolonged benefit to soothe, reduce the inflammation. So this is absolutely a must. Another recommendation, and this is really something that we've been studying for a long time, is our Zircon range. So I don't know if you know, but in the south of France, we have a hydrotherapy center where we treat thousands of patients a year, majority of them being children with actually atopic dermatitis. And besides receiving treatments with the Avène Thermal Spring Water, they also receive treatments with products like Zircon. Now, Zircon, it's important to really acknowledge that it's so unique on the market. This is one of the few products that you'll find out there that is completely sterile. So I want to talk about that. We use a triple sterilization method that is exclusive, patented, and unique in the world. So it's patented by our founder, Pierre Fab, and it entails really sterilizing the formula. Then it's packaged in the same environment as injectable drugs. And of course, it's then packaged in our Defi system. Now what you'll see here is a one-way air valve that no air will ever penetrate past that valve, which means you have a product that is completely sterile. It's free of any listed and unlisted preservatives, and of course, making it safe for newborns and up, no period after opening. So first and foremost, safety, right? Second of all, what benefits is this going to have for all of those triggers that we talked about? I'm just going to apply some on your hand there. Well, the benefits that you're going to receive from Zircon, first and foremost, we're going to target all of this.
That feels really good.
Yeah, how is that?
That feels really nice.
Yeah, it's been pretty dry in here, so feels nice.
It's great for dry hands at this time of year. Thank you.
Actually, I like to use this all over.
It's penetrated quite quickly too. It's not very sticky at all. Thank you.
I was just telling them before we started, we were in like Winnipeg and Regina last week where it's really, really dry. And this has to come with me at all times because for that dry, itchy weather, you definitely need something to replenish. So going back into the symptoms that it's going to treat, we have Avène thermal spring water in the product, of course, so soothing, anti-irritating, anti-inflammatory. We also have a very unique ingredient called I-Modulia. Basically, this is going to be the most powerful anti-itch. So most of your eczema patients or customers are constantly talking about itch being such a concern. And we have studies really validating this reduces all types of itch. So it could be eczema, it could be chicken pox, it could be medication. A number of different things induce itch, and this is going to be your most powerful anti-itch. Of course, it's going to replenish that moisture barrier that we talked about, sealing that so that you keep all the water in, keep aggressors out, and in the meantime, reducing inflammation and itch.
And it's really going to benefit also from the perspective if a child is having trouble sleeping, perhaps, the fact that it's anti-itch and it's going to reduce itch, they're going to sleep a whole lot better too.
Yes.
I think, yeah.
I think we talk to a lot of mothers with newborns who their whole household isn't getting any sleep because itch, it's such an important factor that plays a role with eczema. So in terms of quality of life, very important. You'll increase that quality of life thanks to something that's going to reduce those symptoms.
So what kind of steps can we do to avoid these flare-ups? I mean, we can use the Zircon cream. I see that you have another product here as well, the cleansing gel as well.
Yes. So, of course, hygiene, it's really important to talk about cleansers when we talk about any type of sensitive skins. Commonly, there'll be people asking, I have this and this concern, and when you ask them, what are you cleansing with? They'll say things like, oh, just a bar of soap. And a little bit of an FYI for those of you guys that maybe you're using some soap. Every time that we use soap on our skin, what happens? We actually completely destroy that hydrolipidic film that we were talking about. You completely destroy it. It takes our body 8 hours to rebuild that hydrolipidic film. So we could be going one step forward with the right emollient and then 2 steps backwards if we're using a soap that's going to destroy that. So it's important, yes, to clean, but with something soap-free that's going to be gentle but also clean. So, of course, in the case of eczema or atopic dermatitis, Zircon has the Zircon Cleansing Oil. Just a heads up for you guys.
I did say gel. My correction.
That's
it is
okay.
a cleansing oil.
It is a cleansing oil. That's okay. Important though, it doesn't come out like a greasy oil. Just so you guys know, I know a lot of people. I don't want oils in my bathtub. It's actually like a dry oil. It's almost like a milky feel. So it's really, really nice to use. And what I love about this as well is it's safe for newborns and up. It will also reduce the itch, reduce the inflammation. It'll help rebuild, of course, that moisture barrier that's impaired. And it's like I said, it's safe. It's been approved by gynecologists, ophthalmologists, pediatricians, and dermatologists.
That sounds great.
Yes, yes. A little bit more about just day-to-day things that you can do to help really reduce the flare-ups. The big one, especially right now when it's still a little bit cold, people love to take hot showers. It's a big no-no. If you suffer from eczema, reactive skin, atopic skin in general, you want to keep your showers to a maximum of 15 minutes, lukewarm water. Of course, afterwards, never any friction, be it with your towel or with your clothing. Try to pat dry your skin. And even when you still have about a 10-15% moisture level, that's actually the perfect time to apply your moisturizer. So those are a few things that you can do.
Those are great steps.
Yeah.
So for those of us that are just joining us now, welcome. We're here with Fabiola, Avène's regional trainer, to talk about reactive and hypersensitive skin and some of the triggers. I just want to remind you to post your questions on the live stream and you'll be automatically entered to win an Avène skincare prize pack. So thank you again for joining us.
Thanks, Maya. And we already have some questions coming in. So thank you guys for sending in your questions. We'll get to them in a moment.
So why is Zircon the safest recommendation, in your opinion, for atopic skin?
So because we have that clinically validated benefit that it will absolutely be the best to reduce the itch, the fact that it's completely sterile. Of course, you know, it's made with the same rigor of a pharmaceutical company, packaged in the same environment as injectable drugs, and it's been approved by pediatricians. This is going to be your safest recommendation, even for a newborn and up that is suffering from atopic skin.
So we also have a few other items that we brought to feature today: the cleansing lotion and the tolerance, and the creams.
Yes.
Would you like to tell us about those?
Absolutely. So moving a little bit away from atopic skin, more into another thing we hear a lot about, which is intolerant skin. So I don't know if maybe you know someone. I think we all have a friend that's allergic to everything. And they've always been this way.
I might be that friend.
Oh no. Okay, well, we have something for you. So, there's always that person that maybe their whole life they've always been reactive. They've always been allergic. There's very few things that they can tolerate, both externally as well as internally. And for this type of person, you need something that's going to be absolutely safe but efficient. And so just recently, we relaunched our Tolerance Extreme range. So we only brought a couple of them here today, but we do have a full 24-hour around-the-clock range for those that have that intolerant skin. So a little bit about this. It also is made with that triple sterilization technology that I've already mentioned. So the formula is sterilized, it's packaged in the same environment as injectable drugs, and then of course it's packaged in our Defi tube to ensure that no oxygen will ever penetrate, keeping it safe for the entire duration of the product. These two in particular, our Tolerance Extreme, they're made with a maximum of only 7 ingredients.
Oh wow, that's fabulous.
So one of the benefits of having this packaging is that you have a minimum formula. So the research and development team at Pierre Fab wanted to create something that was going to be the closest imitation of what our skin is naturally made of. And that's what Tolerance is. It's almost like we made a cream version of the Avène Thermal Spring Water, and it's also just made with the essential fatty acids, lipids, everything your skin needs and nothing else. So for those of you out there that are really intolerant to any type of cosmetic or anything topically that you apply and you find it doesn't react well, and maybe you've tried natural, maybe you've tried preservative-free, this is something that it's sterile, it is free of listed and unlisted preservatives, and it's only what your skin needs, nothing else, nothing more.
It would be something that would be really nice to have on hand if you try something and you get an allergic reaction to a fun eyeliner you tried and you got a reaction or a blush. It would address that immediate reaction that you've had.
Yeah, that's definitely why I always have my thermal water on hand, because that's even for the eyes, something that would be safe. But I'm glad that you mentioned having a reaction to, so maybe I'm not allergic to something my whole life, but I suddenly develop a reaction. You know, maybe all of a sudden I switched laundry detergents, or maybe I tried a new fragrance, or maybe something is causing an irritation. In that case, we actually have our Skin Recovery Cream. And our Skin Recovery Cream is again sterile. It's a little bit different than our Tolerance range. This one in particular, it's meant to address when you have symptoms like burning, itching, tingling sensations, really induced by think like contact eczema, or something that happens to me. You know, every time I go to the East Coast and it drops below 30, I get a form of freezer burn on my face. Oh, no. Because my skin has not yet developed enough protection for that type of weather. And so in order to stop the redness and the burning and the irritation, our Skin Recovery Cream has a molecule called parcerin. And basically what it's going to do is just block the burning, block the irritation, restore your skin back to its healthy and natural form. So these are all great suggestions if these are symptoms that you typically suffer from, and there's going to be a safe, clinically validated way to treat them. And of course, they're beautiful products. So something that we specialize in Avène is not just the dermatological backing, but it's something that's created for sensitive skins, good for all skins, but it's also cosmetically very appealing, as you can see. How does that feel?
That's really soothing. It's cooling. It cools on contact. I really like that. It feels like it's instantly hydrating. I really like that. Thank you.
Excellent.
Would someone be able to use something like this on their eyes, or would this be strictly for the face? If they have maybe perhaps a dryness around the eyes. I know some customers have come in the past and have had eczema on the eyelid, maybe from cosmetics or maybe just as dryness that they're prone to.
Definitely. So we actually commonly see people, whether it's atopic reactions right on the eyelids or these type of reactions, there's a couple of things you can recommend. Again, the thermal water, it's always a go-to, but in terms of creams, there's a couple things I'll recommend. Our Tolerance Extreme range would be okay. You want to be very careful though. Of course, the skin around the eyes, it's a lot thinner than the skin around the face. Typically with any eye cream, you only go over the brow bone and the upper part and around. You never really go on the eyelid. However, at Avène, we do have an eye cream that is safe to use directly on the eyelids. It's our Soothing Eye Contour Cream. It's a small little 15 ml. You'll find it there on the top of the Avène shelf. And it's one of our best sellers actually, because it's one of the few on the market.
It's small but powerful.
Yes. It's one of the few there on the market that you can use right on there. Not only will it hydrate and soothe the eyes because of the thermal water in the product, but actually also has dextrine sulfate, so it'll help with puffiness if you have that concern as well.
Oh, that's great. Yeah. So with the summer months just around the corner for some of our viewers, how important is sun care, and what can we do for reactive skins that are going to be in the sun, or perhaps just anybody?
Yes, so I'm glad that you asked, because I'm obsessed with sun care. I constantly get people asking me, if you could summarize it, what is the most important component in terms of having beautiful, healthy skin? Hydration, cleansing, and sun. Honestly, if you could just minimize it to 3 things, and I can't stress the importance of SPF. So even though we live in cities like Vancouver where it's pouring rain outside right now. And
we're hopeful it'll get better. Right?
Sometimes we don't see sun for quite some time. I still use SPF 50 plus every single day of the year. So what I brought with me today is actually a few of our sun products that are the most recommended for those people suffering from atopic skin, reactive skin, basically someone that can't have anything even penetrating the skin. So I'll begin with our most it's what I like to call our most medical segment. This is our original mineral line. It's only titanium dioxide in 2 sizes. That's it. So I'll quickly explain a little bit how does sun protection work? Well, when we talk about mineral protection, it's really, really simple. I want you to imagine that you have a million little tiny mirrors on your skin, and they basically will deflect all the UV rays right off of your skin, not allowing them to penetrate. So it's a very safe and natural way to protect you from the sun because nothing will penetrate. And this is why this is the most recommendable for anyone. Think if you are on a photosensitive medication, if you're hyperactive, if you hyperreactive skin, if you have atopic skin, perhaps you've had skin cancer, maybe you want to protect a tattoo even. There's a number of different cases because this is going to create an actual barrier on the skin. So it gives you that maximum safety. It is very water resistant. Especially this is popular with kids, I find, because you want to see exactly where your child has it on. So it's good for that as well.
And if they're going in and out of the water, it's nice to have that physical barrier that maybe lasts a little bit longer for them as well.
Exactly. This is very, very water resistant. You might have a hard time getting it off. It's so water resistant, but it's definitely your best bet for maximum protection. I do want to, however, talk about a couple of these guys. We launched these last year. We've had a phenomenal year with these. They've done really well. So I'm going to demo them on you. This one comes out actually like a fluid. It's also 100% mineral, so it's free of any chemical filters. And of course, it is completely fluid, as you can see there. So completely invisible. The nice thing with these ones is they actually have a built-in moisturizer. So your face has an 8 hours moisture, your body has 24 hours moisture, but you're only using titanium dioxide and zinc oxide, no chemical filters, no alcohol, no oils. So definitely something that I know we get a lot of questions about, and kind of the consumers are moving more towards mineral protection, of course. And
it feels really lightweight. Even with one of the other moisturizers that I had on my hand earlier, it really does feel lightweight. I quite like that. And it's scent-free.
Yes, totally fragrance-free. This one is great. The one that you last tried is great, really for everyday city block. Say you live here. or where you just want something invisible that's going to give you that protection and a little bit of moisture even. It's great to use all year round. But of course, I also brought my favorite with me. For those of you that know, the Compact is my favorite. I like something simple and easy to use, but of course it's going to give me excellent protection. So Avène, we've had the SPF 50 plus Tinted Compact for a long time. A lot of people think that this is makeup. It's actually not. Interestingly enough, it's exactly what this is, but with 14% tint. So it's pure SPF protection with a little bit of tint, and it's so beautiful that I don't have to use foundation when I use this. So I'm going to demo a little bit on you if that's okay.
Sure.
So this is the light, and I think Maya might be a little bit light. And even though it may appear a certain color, remember the pigmentation is actually very, very minimal on here. So I'll apply a little bit on her hand, and you can actually see it's almost a perfect blend with your color. Now, what is the beautiful thing about this? When you apply this on your face, because it creates a physical block, you actually don't need to be constantly reapplying it. As long as you're not touching your face, you're getting that great SPF 50 plus protection all throughout the day, which is going to be your best anti-age, your best sun protection, and of course, it's going to even out your skin tone.
That's great. That feels really nice.
And you can see it's like a perfect match actually for your skin.
So we have a question from one of our viewers.
Great.
Thank you, Bernadette, for posing this question. Are the Avène sunscreens safe for baby?
Excellent question. So for a child, you want to recommend our SPF 50 plus mineral range. This is going to be the safest for 6 months and up. So this would be for your infants, and then of course the rest of our range as well, same age group.
That's great. Thank you so much for posing the question. We have another one.
Yes.
We heard about the Zircon and have been using it for the baby sensitive skin. It seems to work great, but I don't think it says on the bottle if it can be used for babies. Is there a recommended age for Zircon? Thank you, Bernadette.
Thank you for your question. Actually, yes. So of course, Zircon, not only the emollient, but also the cleanser. They're both totally safe for newborns and up. And actually, anything that you see with our Sterile Cosmetics logo is going to be safe for newborns. So that means your Zircon, it means your Zircon cleanser, your Avène thermal water, and any of these. So that was a great question. Thank you.
We have another one. Thank you so much for posing the questions. This is great. So from Joni, what are some products or procedures to help reduce redness?
Great question. So when we look at redness, there's a few different causes. So I think it's important to first establish what type of redness are we dealing with. Are we talking about rosacea? Rosacea is becoming a little bit more prevalent today. Or are we talking about redness induced by sun? Or are we talking about redness induced by perhaps atopic skin? So really depending on that specific case. Joni, I think was her name. If you do have rosacea, we have a beautiful anti-redness range that will really increase your blood circulation, reduce the redness, cool right away, and help reduce that. Avène thermal spring water is always great to help reduce the redness. Maybe if you've been exposed to some sun or to something irritating to the skin, the Avène thermal water will reduce that redness right away. And additionally, I would strongly suggest your skin recovery cream. Your skin recovery cream, again, it has that molecule in it that's going to block anything that's inducing inflammation and redness in your skin, restoring it back to its natural form, and of course in a sterile way so it's safe to use.
So thank you so much for your questions. Just a reminder, and for anyone that's tuning in right now, I'm Maya from London Drugs. I'm the beauty advisor, and this is Fabiola, the regional trainer for Western Canada for Avène. We're talking about hypersensitive skin, reactive skin. We talked a little bit about the sun products and how safe they are for babies, and also the Zircon brand that is also safe for babies, adults, so everyone in the family can use it. Post your questions on the live stream, of course, and you'll be automatically entered to win an Avène skincare prize pack. So we have another question from one of our viewers, Cindy. Are there any Avène products that address dark circles under the eyes? And how about wrinkles and lines?
Yes, yes, and yes. Definitely at Avène, we have launched a few different eye creams to address all of those concerns. So when we talk about dark circles under the eyes, is typically we have some water retention, blood pigmentation, puffiness. So we use something called dextrane sulfate in our eye creams. So you will find that in our Physiolift eye cream. So the range looks like this, but it's the eye cream. The Physiolift eye cream has the dextrane sulfate that's going to target your puffiness. It's also going to help with dark circles. But because this is part of our anti-age range, it's also going to target, of course, wrinkles that you might have. So it's got hyaluronic acid, ascophylline, that dextrane sulfate. So definitely targeting every single one of those concerns. But we also do have an eye cream in our Serenage range, which will address puffiness. And of course, we have that, which we talked about earlier, the Soothing Eye Contour Cream, safe to use on the eyelids, and it will address puffiness as well.
So I think it really depends also, I think what age we're talking about as well, in terms of what eye cream that we go to as well.
Absolutely. So that Soothing Eye Contour Cream, it's any age can use it. That's the one that's safe to use on the eyelids. When we look into the ones with anti-age in them, of course, kind of to divide it by ranges, we have one in the Easthiel range, ages 25 to 40. Physiolift is recommended for 40 to 60, and the Serenage is for 60 and up. Every single one of them contains dextrane sulfate, so they'll all work on puffiness, and kind of depending on your age, that's where the ingredients for be it wrinkles or radiance will kind of vary.
Great, thank you. So we have another question from one of our viewers, Jennifer. Do you have any products that help refine your pores and don't clog them? So many products fill pores rather than refine them. What a great question. Thanks, Jennifer.
Yes, thanks for that question. So absolutely safe to say 100% of our products are non-comedogenic, so they will not clog your pores. But more specifically, if you're suffering from large pores, we do have a full portfolio of products that will address large pores, oily skin, and these concerns. It's called our Clean-On's range. So what I would strongly suggest is our Clean-On's Cleansing Gel. I'm sure you're familiar with it. It's actually one of our top performers. It does very, very well. The Clean-On's Cleansing Gel is that one, the large one comes in the blue. Mm-hmm. And it will reduce inflammation. It will control oil production, which oftentimes has to do with the size of the pore. It will help with that. And it has a matching toner. It's the Clean-On's Mattifying Lotion. And that one is really going to help really minimize those pores, control oil production, and of course, those are safe on sensitive skins as well.
So it's not necessarily closing the pores. I know sometimes we hear that it closes the pores, but it's more about refining them and just making them smaller rather than closing them, because we want the skin to breathe, right?
Absolutely. We hear it all the time. You know, we're living in a generation where things are instant and people are so used to living behind filters and they want perfection right away. Yeah. But we in fact need the pores. So it's really a matter of addressing, you know, what's underneath them that we can use to help minimize what's making them larger, to refine them, like you said, and make them a little bit smoother. Definitely.
That's great. That's a great question. Thank you. So we have a question from Samantha. Can you recommend a daily cleanser for sensitive and reactive skin?
Absolutely, absolutely. So there's a couple different ones that I would recommend. We actually have our Tolerance Extreme Cleansing Cream with us today. If you are someone who is suffering from extremely reactive skin, where all types of cleansers, even the water is hurting your skin. You know, there's some skins that are so sensitive that even the water is painful for their skin.
Hard water especially, right?
Yes, yeah. Definitely. This is something that is becoming more and more prevalent as water quality decreases worldwide. So certainly we've created actually all of our cleansers, which are for the most sensitive skins, they're all specifically designed to be tissue off, because we know that the water can even be irritating for the skin. So our Tolerance Extreme Cleansing Cream is something you can apply. Leave it on for about 30 seconds, take a tissue, hold it down for about 3 seconds, and then wipe it clean, and it will very gently, soap-free, clean your skin. Another one that you could use if you find your skin is really red and burning and you're maybe having a reaction, we actually have the Extra Gentle Cleansing Cleanser. We don't have it on here today, but it's the one that would actually be the equivalent of our Skin Recovery, and that one's really just going to help block any irritation and inflammation you might be having.
That's great, thank you. From Deborah, can you talk about atopic scalp? Any product recommendations to address this? So perhaps itchiness, I guess, would be
absolutely
one of the things that Deborah may experience.
Yes, thank you for your question, Deb. So when we talk about atopic skin, of course, we can't leave out the scalp. Oftentimes, if your skin suffers from a condition, it's not a surprise that your scalp will suffer from it as well. And while things like Avène thermal water will benefit that, in part of the Pierre Fab umbrella, we actually have sister brands of Avène that come to mind that would actually be the perfect solution if you are suffering from things like itchy, inflamed, and maybe even some desquamation or dandruff coming from your scalp. Not to say that it would be dandruff, but definitely something like atopic skin on the scalp. So I would strongly recommend one of our sister brands. It's called Ducray. That is definitely something you can look into, but we have a new product called Caliol DS, which I would recommend to you from Ducray. That would be a great one. Again, the Avène thermal water is definitely going to be soothing.
What about the cleansing oil? Would the cleansing oil be okay in the scalp as well?
The Zircon will, of course, help reduce the itch as well. And especially, I'm glad that you brought up the cleansing oil. We recommend that also oftentimes when babies have cradle cap as well. So definitely use all of these products to help decrease the symptoms. But if you're looking for more of a long-term solution, you could look into Ducray as well.
Great, thank you. Thank you so much. So we have a question from Ruby. Zircon Cleansing is the best hand wash for sensitive eczema-prone hands. What a great tip.
Thanks for your feedback, Ruby.
Thanks, Ruby, for your feedback.
We have another great hand cream, actually. Sorry, since we're talking about hands, and I know atopic hands and occupational eczema, especially nurses, like I talk to a lot of pharmacists, and their hands are just from washing them all the time. So we actually have something called Sulfate hand cream, and what's beautiful about it is it contains sucralfate. It will repair any cuts and cracks that you might have on your skin, but it also has copper zinc sulfate complex, so it's going to prevent any infection. So great for flu season, and my favorite thing about it, 5 hand washes. So
I was just going to ask, how many washes does it last?
You can wash your hands again and again, and you're still going to get that protection. And it feels invisible, so I'm sure you've tried it.
Yes, I have. Yeah. It does feel really nice.
Yes.
So we have another question from Susie. Susie loves Avène products. Thank you, Susie. And uses the cleansing gel every single day that we talked about and have for years. But now she's in her 50s and is a little bit drying for her. I love gel cleansers, and I was wondering if you have any suggestions for a little bit more gentle cleanser for me. I have super sensitive skin and I can only use Avène products. I wish you'd bring back your foundation, she says.
Oh, thank you.
Susie.
So a few different things there to address. So happy that you're using the right cleansers. Of course, that's very important. And it's not uncommon that as we age, our skin becomes a little bit drier. What's actually happening is we're not producing as many lipids as we used to. So we're missing things like ceramides, essential fatty acids in our skin. So there's a couple of different things. If you wanted to go for something easy that you could use for face or body, I would strongly suggest Trixera has a cleansing gel that you could use for face or body. And it's really for dry skin. It's, of course, going to help soothe any itch, but really just make sure that your skin has everything that it needs. Of course, if you want something more specific for the face, I would actually recommend our gentle cleansing milk. If you wanted to try that for your face, particularly because, like I said, as we get older, our skin isn't producing lipids, and typically gel cleansers are a little bit more for, of course, oilier skins. So it might be a good time to maybe revisit that and transition into something like the milk. Of course, our 3-in-1 is great too, which you can tissue off, or if you still really wanted to go with the gel version, you could go with that Trixera gel. And I think she had mentioned something about the foundation. So although we don't carry, here in the west of Canada, we don't carry our Couvrance range, actually I'm very excited. We have something coming up just at the end of the month, which I think she might love. We're coming out with a brand new product. It's part of our mineral range, and it's a tinted complexion corrector. So it doubles as a foundation. It's got your moisturizer built in. It actually also has a blurring effect. So you've got a blurring cream, a moisturizer, SPF protection, no chemical filters, and it's also got a antioxidant protection, brightening, and it comes in 3 different shades. So Susie, I know you're missing the foundation. I think that might be perfect for you as well. And that's coming to London Drugs, actually, end of the month. So look out for that.
That's great. Thank you so much, Fabiola. I'm afraid that's all the time that we have. I am Maya from London Drugs, and with Fabiola here from Avène, the Regional Western Canada Trainer. Just to mention the contest again, with your comments and or questions, enter into the you'll be automatically entered into the contest for the Avène Skincare Prize Pack. Many products we mentioned here today, of course, are available in the store at London Drugs and online, and we'll be updating the products onto the Facebook Live event page as well. So thank you so much for joining us today and taking the time to hang out with us.
Thank you, Maya. Thanks for having me.
Fabiola.
And thanks, guys, for all of your great questions.